The Gauteng Premier, David Makhura, says that the Special Investigating Unit has now identified officials who may have been responsible for alleged PPE procurement corruption. He also says the State Security Agency is going to compile lifestyle audits of MECs to ensure they're not living beyond their means. You know, of course, of the huge public outrage that all of this has caused. Last week, the Gauteng ANC told the Gauteng Health MEC, Dr. Bandile Masuku, and his wife, Vuyo Mhaga, to step down from their positions temporarily. Vuyo Mhaga is the spokesperson for the Gauteng Premier. Vuyo, good afternoon to you. What's the Special Investigating Unit found so far?
Well, afternoon, Stephen. Obviously, they found that there were both two officials in the Department of Health, the one who's currently there and the one who's actually will have actually resigned, that they enabled the situation for the facilitation allegedly of of corruption to basically happen, and it was the belief of the Gauteng government that therefore the current one, who is actually still an employee of the state, must be suspended, and obviously criminal charges to be inferred to the one who will have actually resigned, including the current one.
Okay, so one official resigned. We know that at the end of May, the Chief Financial Officer in the Gauteng Health Department, Kabelo Lachwenya, resigned. Is that the person that's also being investigated?
Correct. Remember, the Premier did actually say to the journalist that the former CFO, as well as the Chief Director of Supply Chain, those are the two officials that we're talking about.
Okay, at this stage, have any formal charges been put to them, or are they just being investigated?
No, the criminal charges will be laid to them by the SIU.
Okay, so you're waiting for them for that to happen?
Yes, yes, indeed.
There will be questions, of course, about why there wasn't an investigation the moment that someone resigned. I mean, I've said this before on this channel at roughly this time, in fact, for the Chief Financial Officer of the Gauteng Health Department to resign at the time when the department was probably spending more money in a shorter space of time than ever before because of the pandemic. I mean, I hate to say it, we live in a cynical time, but that immediately raises questions.
No. Remember, Stephen, it's just maybe it's an issue that it might not have been reported quite widely. On the 25th of May, somewhere there, the Premier actually, if you can go back to our records, on the 5th of June, the Premier did indicate that on the 25th of May, he had requested the SIU to look at the affairs of the health department in particular. So this came as a result of the Gauteng audit services that they say that they believe that there was something wrong. So already on the 25th of May, the work of the SIU was actually that this is a fruition of the work that they've been actually undertaking. So it's not a work that prompted by what will obviously the president is actually made the proclamation, is the work that will have been started some time back around May. You'll remember that Gauteng government has got a memorandum of understanding with the SIU, as and when we feel that we need their services, we are able to actually go to them and actually request that. So it's the work that has been actually done previously.
Okay, I mean, there's a whole lot of outrage where you've clearly felt that. Gauteng has felt that. I think the nation has felt that. We shouldn't forget, though, and the legal people I've spoken to have, I think, confirmed this, that it's actually not illegal for a family member or a friend of someone, either in the provincial health department as an MEC or a member of the mayoral committee in the case of Vuyo Mhaga, to actually get a contract with the state. It's not illegal.
No, correct. Remember, as the Premier would have said, we'll inform residents of Gauteng as and when the reports are basically coming in. Now we're actually bringing this particular report about the two officials, the one who have left and the one who was actually there. As and when the SIU is able to give us the reports, we'll be able to inform people of Gauteng. So we're not going to wait for the whole entire investigation to happen. As and when the work is done and is concluded, we're able to take action and we're able to take people of Gauteng along.
Okay, the lifestyle audits of the MEC, of the MECs rather, what is the Premier David Makhura asking the State Security Agency to do here?
Well, you'll appreciate that the lifestyle audit, it's really what you get as your legal income in every setup is actually in line with what you obviously have, and that work will obviously be looked at by the state security. This is an issue, by the way, that the Premier did actually allude to, that as far as back as 2019, he had actually made that particular undertaking, but it was about the correct institution that will actually do this work. So as of next week, the SSA will be able to look into this. And also there is actually time bound by between the 6th to the 8th week. We must be able to then get the report and inform people of Gauteng in terms of the lifestyle of those who are, responsible to discharge services.
Okay, so Vuyo, if I understand it correctly, and let's use a hypothetical example, if an MEC says and declares that the only income they have is that they're a member of the provincial legislature in Gauteng, and then their salary is a member of the executive as an MEC, so if they get those salaries, and that's what they say, and then they're driving, I don't know, a 3 million rand car, just as an example, that would suggest there's a problem.
Yeah, well, they must be able to explain how are they able to afford that kind of a lifestyle on this amount of a salary. And I guess the details of that, the SSA will be able to get in much more detail. I'll assume because they are the experts in the field. But between me and you, in our understanding, that is exactly. Do what I declare as in my income reflect my style of living?
Okay, I can just see the arguments that are developing, and of course Gauteng could set a trend here. It's going to get very, very interesting for cabinet ministers and former cabinet ministers as well. Vuyo, I do want to talk a little bit about the State Security Agency. Why them?
Well, as the Premier would have said, we will have looked at which one it would be there, and then ultimately agreed that it must be the State Security Agency, working, by the way, together with SARS. So it will be that combination, but the SSA would be, we felt that it is actually the right institution.
Finances, it's people's personal finances, so the MECs will actually have to agree to this. I mean, SARS is not going to cough up taxpayer information.
Well, they are public servants, so you'll appreciate that there are added responsibilities towards public servants. Those who have said, I want to serve people of Gauteng, must be able to be open up to say, we want to understand that you are not really taking our money, and actually we are not bankrolling your lifestyle outside what we're actually paying you. So I don't really see it to be much of a problem.
The State Security Agency, Vuyo, again, we live in a cynical time. It's had a very difficult history, all sorts of claims of partisanship. You reckon it'll be independent here?
Well, they are the institution of government. Let's give them the space that they must be able to do that. Because if it's not them, who? They are the one who are tasked by to do this kind of work. We can't really do it ourselves.
Trust me, I'm a spy, Vuyo.
Okay. I always suspected, Stephen.
So we've got a lot going on, a lot of anger and frustration at corruption. We can see that the Premier himself, when he's spoken previously, is actually, I get the sense, being quite angry and frustrated himself about what's happening. In the meantime, we don't know yet when Dr. Bandile Masuku will come back. We're in the middle of a pandemic. Jacob Mamabolo, the Transport MEC, is acting MEC. Is the Premier happy with how he's performing so far? I realize it's a very difficult situation.
Well, if you look at the numbers today, Stephen, it's just a pity. Obviously, this matter of corruption has taken over the limelight to the actual work that we've been actually reporting to every week. If you look at the numbers are still are dropping nicely in Gauteng. Obviously, we are not out of the woods yet. We are not yet ready to celebrate, but we are cautiously optimistic that we are moving in the right direction. The pressure in the public health system has started to drop, so there are very few people than before that are actually occupying the hospital beds. So we're optimistically, we are cautiously optimistic that we're moving in the right direction. But as you all know, Dr. Zulimkis and other doctors and scientists say we might actually go to another surge. So we are quite conscious, and we want to reiterate that people of Gauteng must make sure that they abide by the protocols, wear their mask, only go out when it's extremely necessary, make sure that they do their regular washing. Together, we believe we can be able to defeat this virus, and we've got a full trust in the healthcare workers of Gauteng.
There are a few things that do need to be done after all of this. The head of the ICU unit at Chris Hani Baragwanath, Professor Ruda Matiba, said yesterday, I think you can appreciate she's very much on the front line. I mean, a terrible job, very difficult job. We're lucky to have her, frankly. She was saying yesterday that one thing that health workers do need is a little bit of debriefing. I get the sense that everyone involved in the healthcare sector is going to need a little bit of psychological help, is going to need a little bit of space after all of this. Are we going to be able to do that? I don't know how we thank them as a province, but I think we should do something.
Well, we are extremely indebted to the healthcare workers in the province. They've done, by the way, for a very long time. They've managed to hold the system, but in particular during this particular period. That's why all material times, the Premier is able to show his gratitude to the work that they've actually done to make sure that they're able to save lives and they're able to provide hope under a massive strain. The healthcare workers have actually been our real heroes during this pandemic.
All right, and Vuyo, I mean, it's Friday today, football starting for the first time tomorrow. I'm not going to ask you which side of that you're on, but there'll be a lot of people who will say, well, as the numbers go down, we need to start relooking at certain substances that are banned. Does the Premier have any view on whether alcohol should be unbanned yet?
No, we are quite happy with the situation as it is. It actually removes a lot of pressure from the trauma unit, and I think the doctors have actually expressed in one of our media briefings that at least they are able to focus what is actually the current challenge, which is the pandemic. So the Gauteng citizen must watch football in a sober space, and I think it will be a very good experience to really see the results.
Interesting to see who's actually playing at Orlando tomorrow. Vuyo Mhaga, thanks very much indeed. The spokesperson for the Gauteng Premier, David Makhura, here on Newsweek.